Hi there, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to be talking to you about hip and or groin pain in runners, what is causing it and what can you be doing about it. But before I do, I want to tell you a little bit about me and my team. My team and I are super passionate about keeping you running. We want to make sure that you are empowered with the knowledge to prevent injury, and then when injury does hit, that you know how to manage your injury best to make sure you can get back to enjoying your running. We hold weekly Q&A sessions where you can ask questions about your injury, pain or training, so please do come along to those. If you can't make it, and they're streamed on Facebook and all other social media platforms, if you can't make it, you can ask questions in advance, we will answer them, and then you can watch the playback. We also have a whole load of exercises, stretches, advice videos on our website, so please do go and check those out. The two that I would recommend that you watch now for starters would be the best exercises for runners and how I can recover, or the best ways of recovering from injury. So please do check those ones out. Now, the vast majority of running injuries, you don't need to stop running. It's more about modification of the injury. However, there are a very small number of running injuries that do require rest, and if you don't rest, then you can end up with life-threatening or limb-threatening issues. So it's really, really important that you get your injury checked out. Nowadays, with modern technology, there's no reason the geography doesn't stop you from seeking expert advice. We do video consultations that work fantastically. We have over 350 5-star reviews, so please do check those out if you want to find out how video consultations work. Best thing to do is to get in touch, email us reception@octopusclinic.com. So, hip or groin pain in runners, what's causing it? And most importantly, what can you be doing about it? Now that very much depends on the location of your pain. So many runners will experience pain on the outer aspect of the hip, the front of the hip, the inner groin or front of the groin area, and also in the buttock. So depending on the location of that pain will give us some indication as to the structure that's causing the pain. But before I move on to all those different aspects of hip and groin pain, I do just want to highlight that the hip area is one of the locations that is one of the most common areas for stress fractures in runners. And if you do have a stress fracture in your hip, it's really important that we pick it up early, you rest it, and we get the right management plan in place, because it can be a very severe, if not life-threatening condition. As I say, it's rare, and it's much more likely that your pain is being caused by a tendon or a muscle, and that we can just manage it with physio, and that you don't need to rest from running. But until you've had that diagnosis, please do not run through any pain, and don't do any exercises that are painful. So, moving on to the different locations of your pain. One of the most common areas that people find that they have pain when they're running is over the outer part of the hip. So over this outside area here, and often it can be quite tender to touch over the outer part of that bony bit of the hip. Often it's diagnosed as bursitis, and that's because where the location of the pain is, there is a bursa. Now a bursa is a little pocket of fluid that sits underneath a tendon, between a tendon and a bone. You've got them all over your body. This one on the outside of the hip sits underneath a tendon, your gluteus medius tendon. So the tendon passes over the bone, and just underneath it sits a bursa. Now we used to call it a bursitis. We used to think that that was the primary cause of the pain, but we now know that it's a combination, probably if you have pain in that area, it's a combination of a bit of inflammation of the bursa and your tendon. And the great news is that if you have that diagnosis, the best treatment is a loading program. Now we start with static loading, and then we build to add a little bit of movement. and then we add a bit more load, a bit more some weights, and then we add speed, or a combination of those things to get you back to pain-free running. But the first step is to do static contractions. So you can stand and you just gently pull. So you stand and you gently just contract your gluteus medius muscles, and you hold them for about a count of 6, and then you repeat that as frequently as you can, and that might actually reduce your pain. Now that's the first step, and as I say, from there you then progress to adding a bit of movement and introducing an exercise called the wall ball exercise, which specifically loads the gluteus medius muscle and surrounding muscles in a position that is a standing position, so therefore you get really nice carryover into running. So that's the first location. Now it's also really important to look at other aspects, and I'll come on to that at the end, but around things like your general load management, so what you're doing with your training program, how frequently you're running, have you recently suddenly introduced hills, that kind of thing, and making some modifications to those things. Now, next part, I would say probably the next most common area is pain over the front of the hip or over the front of the groin, and that could be your hip flexor tendons, hip flexor muscles. So again, it's all about loading those tendons and muscles. So there's an exercise where you sit and you just push up against the resistance of your leg and you hold it, and then relax and repeat that again. So you hold, so you push up against your hand, hold it for 6 seconds, and then relax, and do that frequently, and that should reduce your pain. Then slowly but surely you introduce movement, more load, and speed to enable that tendon to recover. Now with hip flexor tendons in particular, I noticed that people do loads and loads of hip flexor stretching, and we know that stretching is not good for tendons. So if you have pain at the front of your hip, I would advise against doing hip flexor stretches, and if you have pain at the side of your hip over the gluteus medius, as we've already discussed, I would advise you against doing stretches of that muscle too. So next muscle, your adductor muscles. Now your adductor muscles run up the inside of your thigh and then insert into the bony bit in your bottom. No, they don't. They insert into the bony bit at the front of your pelvis. It's again a very similar loading program for those. So you can put your hand between your knees and you can squeeze to contract those muscles statically. Hold for 6 seconds, repeat as many times as possible. And then slowly but surely you can introduce movement. Now with pain over the inside of your groin, you also need to be careful of the pubic symphysis, which is the joint right at the front of your pelvis. It can be very, very irritable, so it's really important that we clear for that as well. Now, last but not least, if you have pain in your buttock, pain in the buttock can be caused by lots of things, not least referred from your back. And in fact, any pains in the groin, the outside of the hip, the buttock can be referred from your lower back. So it's really important that we work out whether that's a contributing factor. But presuming it's not, if you can touch the bit of the bony bit in your bottom, that's where your hamstring tendon inserts. So it's quite common to get a tendinopathy of the hamstring tendon. Now you might have noticed that throughout this I've been talking about tendinopathies, not tendinitises. So that's because we know now that instead of a tendon pain being inflammatory, so that's what the itis bit of tendinitis means, inflammatory, we know it's not inflammatory. We know that when a tendon is painful, there's been a process taking place that changes the structure of the tendon, the collagen, the blood vessels, the nerves in the tendon, so that it's a much slower process, and therefore it doesn't respond to the same things that an inflammatory condition will respond to. Hence why icing and things won't cut the mustard, and we need to do, as I say, a loading program. So back to your hamstring tendon. So as I say, if you've got tenderness right where the hamstring inserts into your bum, you want to do the same, follow the same principles that I've mentioned with the other tendons. So you want to make sure that you don't stretch it, so just avoid doing hamstring stretches or positions where you naturally stretch your hamstring. And you want to be doing or making sure that you're not, if it's really sore, making sure you're not weight bearing too much over it. So being creative with cushions with your seating, otherwise just sitting straight on it's going to aggravate it. And then again, doing some static contractions, so sitting and just without moving your leg, pulling your heel towards your buttock to statically contract your hamstring muscles, and then building from there with exercises like your waiter's bow exercise that you'll find on the website. So I've just given you a number of different causes of hip pain in runners, but it's, as I say, super important that that you remember that we need to rule out stress fractures, and we need to rule out other causes that I haven't mentioned, not least referral from your back or the hip joint itself. So the hip joint itself can be a significant cause of pain in the groin or the side of the hip or the back of the hip. So it's really important that you do get in touch. Please do contact us, reception@octopusclinic.com, and we can do a video consultation, or if you'd like some more free advice, please do come along to one of our live Q&A sessions on Facebook or social media. And in the meantime, pain-free running, and you take care. Bye.